Poso maoni wiak, waiwanan kitanan ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnamin e hakihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. I'm your host, Sheena Wapoose. On this episode, we are joined by Vaughn Bowles, Public Information Officer for the Menominee Indian Tribe of Wisconsin. Welcome, Vaughn.
Hi, Sheena.
So I would like to remind everyone, as usual, that we request you send in your COVID-19 related questions to us at podcast@mitw.org. So Vaughn, with the CDC changing recommendations for masking for vaccinated people, will the tribe's mask mandates change at all?
So, Incident Command tries to make a point to adhere to a lot of the CDC policies. And so with the changes in the masking, we're looking at also updating our mask policy on the reservation. So that's something that's kind of in the works, and we're still working out. We may have an update on that in a couple weeks. So, yes, changes with the CDC, hopefully changes on the reservation soon to follow.
So can you just talk a little bit about the emergency order that came out yesterday?
Yeah, so it was emergency order number 15. What that was, it was a continuation essentially of emergency order 13. Runs about half of the tribal offices and departments at about 75% in-person capacity, and the other half's at 100% for a lot of our vital infrastructure that mainly relate to health and safety and education. That order remains in effect until June 5th, and we're kind of going to keep an eye on what's going on with the variant spread in Minnesota and Michigan, because they're both having challenges, keeping the COVID variants under control. And so hopefully it doesn't impact Wisconsin too badly, and we'll be able to reevaluate early this summer, and hopefully we'll be able to segue into fully open and operational again.
So has much hasn't really changed from the previous emergency order to this new one?
No, it's pretty much just a continuation. Nothing's really changed this time around.
Okay, so I've been seeing a lot of claims on social media about both virus and vaccine causing like women's health problems like miscarriages, infertility, other things like that. Can you just talk about that a little bit? Yeah,
and we can tackle that question from both directions of, getting the virus and getting the vaccine. So, a statement put out recently by the Mayo Clinic was, COVID-19 overall, the risk for pregnant women is low as far as, risk of fatality and whatnot. However, it increases the risk of a severe case of COVID for the pregnant woman. One of the things that could result in is they've found that it increases the risk for a preterm birth, so anything before 37 weeks. So it kind of puts the fetus or the infant at risk for long-term complications that are associated with preterm birth, respiratory issues, optical issues, things of that nature. As far as the vaccine goes, they've found that it is, or they believe at this time it's pretty safe for pregnant women. They haven't found that it causes any forms of sterility for women of childbearing age. They do recommend that if you are planning on becoming pregnant, are currently pregnant, or breastfeeding, they want you to consult your healthcare provider and stuff before that. But for the most part, they've found that it's safe. We can actually put some great links in the show notes regarding the effects on pregnancy, vaccination during pregnancy, and then some of the statistics the CDC has out right now for women that have had COVID and its impact on their birth. So we can post those for you guys. You can look that up and read that on your own time. Some of it gets fairly in depth, but it's really good information to get.
So Vaughn, we had one of the most, if not the most popular podcast hosts this week talking about getting the vaccine if you're a younger person. And it was in their opinion that if you're young and you're healthy and you exercise and you eat well, you don't need to get the vaccine. And I know that in our community, it's been consistently the younger population that is the least vaccinated. So can you just talk a little bit about why it's important to get the vaccine, even if you're young and healthy?
So I saw some articles regarding that individual and those opinions. And, he's fully entitled to his opinion. That is 100% sure. I'm going to throw that out there. It's also not a medical doctor. I'm going to throw that out there too. In a sense, he is right about some things. If you are a young and healthy individual, you're not immunocompromised, you are in relatively fit physical condition, you get a fairly decent amount of sleep, you literally have a 99.7% chance of surviving the COVID-19 virus. You probably will not die. And that's totally understandable. I mean, it is what it is at this point. However, there are some things you got to consider. There are long-term complications that we really don't understand from COVID at this point. You can have long-term lung damage, long-term heart damage. It can increase any sort of behavioral health condition. Specifically, it can impact your ability to focus. And they're saying it increases people's symptoms of depression or can lead to depression. Personally, I wouldn't want to deal with those. I would much rather be vaccinated, twice and not have to worry about things like that. Another big question really becomes, how important is it to you to protect your elders in your native community? Herd immunity is the best chance at preventing resurgences of COVID-19. Right now, our population has about 44% of the individuals living within the reservation in the county vaccinated. That's one dose only. 39% are fully vaccinated and have 2 doses. However, if you're trying to reach herd immunity, you need somewhere in the ballpark of 80% of your population or more to either be vaccinated or to have built up a natural immunity. And right now, there's roughly 18% of our population has had COVID, so they've developed a natural immunity. So if you couple that with those that have been vaccinated, we roughly have about 57% of our population that's immune to COVID-19 at this point. That's not really enough to prevent a resurgence, and we can see spikes in the number of new cases because there just aren't enough people that are protected from it. So it really comes down to, will you die from it if you're young and healthy? Probably not. Do you want to protect your community, friends and family that are immunocompromised, the elderly? If you do, vaccination is definitely something you should consider. So, yeah.
So I've also seen in the news some things about breakthrough infections. Can you explain what that is?
Yeah, breakthrough infection is when someone is infected with a specific organism or pathogen that they have been vaccinated against. This would be if you have a COVID vaccine or say a flu shot, and you pick up either COVID or the flu, that would be a breakthrough infection. These typically happen in 3 kind of events. You were exposed to the pathogen before you were inoculated, or you were infected with some sort of variant where the vaccination was less effective and you got infected anyways, or you were vaccinated at an earlier date, but your body's no longer producing things like the antibodies, the T cells, and the B cells to fight off the infection. And you would have required something like a booster shot to continue having the immunity from that specific pathogen. How common are breakthrough infections? It really kind of depends. If you're talking about things like the flu, it's pretty common. The flu shot is only about 40 to 60% effective. So if you get a flu shot, you have a decent chance of still getting the flu. Probably won't be as bad though. Other times when we're talking about things like smallpox or, polio, we have very few of those, if any. As far as with, COVID-19, if you're getting a Pfizer or Moderna vaccine, you have 92 to 95% chance that you probably won't get it. That's pretty good. Is there the possibility of a breakthrough infection? Yeah, it's rare, but it's still prevalent. So it's just something to keep in mind.
So what are some safe activities families or friends can do together right now? The weather is getting a little warmer. Do you have any suggestions for that?
At this point, just about any form of outdoor recreation can be done. That can be done without a crowd is safe. Camping, hiking, kayaking, canoeing, fishing, running, walking, things like that. Anywhere there's open air, a lot of flow, those are pretty safe right now. So yeah, I'd recommend those things. I personally love backpacking and camping, so I'd recommend those. Or not, because then there'd be more people out there. So don't go camping. Leave it for the rest of us.
Okay, so if people are having like potluck kind of get together things, is sharing food safe if everyone is vaccinated?
It's safer if everyone's vaccinated. The CDC hasn't really come out at this point and been like, you can all have your potlucks again, or you can all share food again. They are saying that it is safer to gather if you're all fully vaccinated. They put out new recommendations where they say you can gather indoors with fully vaccinated individuals without wearing masks or staying 6 feet apart now. This is great news. So as far as sharing the food, though, they haven't really released any updates about that at this point.
Okay, would it be safe for vaccinated people to dine outside with no masks? And what about dining inside?
Outside dining, yes, is pretty much considered safe at this point if you've been vaccinated. Indoor dining, it depends on, factors like the size of the facility, the number of people inside, the amount of air circulation, and like physical distance from other people inside of the building. So that one kind of needs to be taken on a case-by-case basis. If you're all, crammed into a, 9x12 shrimp shack or whatever, I'd avoid that. But if it's a restaurant that has some distance between tables and whatnot, you'll probably be all right.
So you mentioned some new CDC guidelines for vaccinated individuals. Can you go over those and also just remind us what fully vaccinated means, that term?
Yeah, so when you're fully vaccinated, you've either had one of the Johnson & Johnson vaccinations, or two of the Pfizer and Moderna ones. You have to wait 2 weeks after either your second vaccination with Pfizer and Moderna, or 2 weeks after the Johnson & Johnson, for your immune system really to build up the materials you need to fight off COVID. So 2 weeks after your last shot is fully vaccinated. So right now they're saying you can gather indoors with fully vaccinated people, no masks, no social distancing. Yay for our side. They also say you can gather indoors with unvaccinated people from one other household without masks or social distancing, as long as none of them are at increased risk for a severe case of COVID-19. So if any of the people are elderly, morbidly obese, had a history of any sort of respiratory illnesses, or are immunocompromised, you'd still need masks and social distancing for those indoor events and for those individuals. They also say you can conduct outdoor activities without wearing a mask, except for like crowded venues, things like sports, concerts, stuff like that. Travel in the United States doesn't require any quarantine periods now, or testing after you go to or from your destination. That's not the case for international travel, and you'll need to check the local health authorities in that country for recommendations there. And they also require you to quarantine after arriving home and being tested. And then there was one other. If you've been around someone with COVID-19 and you don't need to stay away from others, is what they're saying, unless you start exhibiting symptoms. So those are the new updates from the CDC.
Vaughn, did you have any final messages for people this week?
I would strongly encourage the youth of the reservation and of the county to consider really what they consider important, who they consider important. Vaccination is really, we've tried to make it as convenient as possible. And we want to keep you and your family members as healthy as possible. So I would encourage anyone that hasn't been vaccinated to do so at this time.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab. Keep up to date by following us on Facebook at MITW Podcast. We do weekly updates with Vaughn, and we do welcome any community questions you have regarding COVID-19, so please send those to us via email at podcast@mitw.org.